Those distribution plans are put into place. Health agencies want to ensure minority communities aren't left behind.
41 Action News reporter Sarah Blake explains the efforts to ensure everyone who wants to get vaccinated has the resources to do so.
Plans for the COVID-19 vaccine rollout beyond healthcare workers is a work in progress. But we talked to some health agencies who are keeping communities of color in mind.
And we have wide representation by tribal organizations, ethnic and racial minority groups, so different socioeconomic groups, and then beyond that by faith leaders, medical bioethicists.
Because more at-risk groups are likely to use mass transit, the Kansas Department of Health and Environment is targeting transportation hubs to spread information about the vaccine. They're also looking into sending mobile vaccine units to communities where people may not have a car.
We'll be collaborating with our partners, of course, and as time goes on, as the months go on and there's more vaccine available, then we'll look and say, you know, what gaps need to be filled.
But we are definitely going to be encouraging people of color to get vaccinated, particularly because on our survey results, they showed a lot of hesitance.
In this chart, the state includes people at risk for adverse health consequences in the second phase come late winter. The Lawrence Douglas County Health Department will work with churches and cultural centers to encourage Black and brown communities to get vaccinated within this phase.
Yeah, we definitely need to be relying on friends and family and those type of networking, because for a lot of people of color, those are trusted sources of information.
The Missouri Department of Health and Senior Services is waiting to see which at-risk populations will be included in their second phase, but their advisory groups are also meeting weekly to discuss equity. Mayor Quinton Lucas said this is a priority because many Black and brown folks don't have access to stable health care.
I have grave concerns with the fact that if there's a vaccine that's rolled out, it's going to go to the folks that know the institutions, folks like me who may be able to have that physician relationship and call in. But what about everybody else?
Sarah Blake, 41 Action News.